NAPLEX video number 5. Yeah. Dyslipidemia. Definition: elevated total cholesterol, LDL, triglycerides, or HDL. Any elevation in those. Pathophysiology. LDL incites the atherosclerotic inflammatory process response, promoting unstable lesions concentrated with lipid-laden macrophages. So basically you get plaques with macrophages and lipids building up in your arteries. And then because of that, triglycerides have procoagulant properties and adverse impacts on endothelial function. HDL is great though. It reverse transports cholesterol and inhibits LDL oxidation. And prevents platelet aggregation and activation. Risk factors: coronary heart disease, cerebral vascular disease, peripheral artery disease. So heart diseases. Presentation usually asymptomatic. They can have, they can have pain and cramping in their extremities, shortness of breath, chest pain, sweating, on all non-descriptive really symptoms, but usually they're asymptomatic. If it's severe hypertriglyceridemia, you could have pancreatitis symptoms like abdominal pain and nausea and vomiting. Diagnosis: 20 plus, you need a fasting lipid panel every 5 years. Classification: so I just did the things that were the goals. So total cholesterol less than 200, then total triglycerides less than 150, then LDL less than 100, and HDL greater than 60. So HDL is the weird one. It goes 200, 150, 100, 60. Secondary causes of dyslipidemia: obesity, obstructive liver disease, Cushing syndrome, tobacco use, alcohol overuse, hyperthyroidism, anorexia, nephrotic syndrome, diabetes. The list goes on and on and on and on and on and on. Drugs can also increase cholesterol, like beta blockers, estrogen, androgens, glucosteroids, thiazides, protease inhibitors, mirtazapine, cyclosporin, lots of drugs. Prevention: lifestyle modifications. Now I'm just going to list the drugs that you can use for cholesterol, and then we'll kind of go into them more in depth. So cholestyramine, cholestyramine, and colacelvalam, those are the bile acid sequestrants. Niacin, gemfibrozil, fenofibrate, clofibrate, and we've got our statins. Ezetimibe, I like calling it easy-timby, but it's ezetimibe. Then mipomyrcin, lomitipide, alirocumab, and evolumab. And those are the PCSK9 inhibitors. So starting with statins, when do you know when to start a statin? So high-intensity statin if you have clinical ASCVD, so if you had a heart attack, stroke, or anything like that, you have clinical ASCVD, sorry. If you have an LDL of greater than 190 plus, if you're diabetic, age 40 to 75 with an LDL between 70 and 189 without ASCVD. So diabetic patient, age 40 to 75 with an LDL of 70 to 189 without ASCVD needs to be on a high-intensity statin. Or if you're 40 to 75 with an LDL of 70 to 189 and a 10-year ASCVD risk score of 7.5% plus, then you need a high-intensity statin. Everyone gets a statin. So statins, what are they? They competitively inhibit HMG-CoA reductase and reduces biosynthesis of cholesterol precursor melavonate. I got asked this on my rotation all the time. The pleiotropic effects of statins: reduce inflammation, coronary plaque stabilization, improve endothelial function, reduce viscosity and fibrogen levels, reduce uptake of aggregated LDL by vascular smooth muscle, reduce platelet aggregation, suppress release of tissue factor, and then activation of endothelial nitric oxide. Side effects of statins: rarely myalgias. You can get rhabdomyolysis, but it's very rare. Contraindications is pregnancy and active liver disease. because you got to metabolize the statin in the liver. And HMG-CoA reductase is in the liver. Now we've got niacin. It's a B complex vitamin that inhibits hepatic production of VLDL by reducing mobilization of fatty acids from adipose tissue. Side effects, you can have this prostaglandin-mediated flushing, GI upset. You need to use caution in gout and diabetes because it increases uric acid and glucose levels. Bile acid sequestrants bind cholesterol-containing bile acids in the intestinal lumen, preventing reabsorption. Side effects, GI, and it interferes with vitamin absorptions, those fatty, water-soluble vitamins, DAKE, D-A-K-E. Then we've got omega-3 fatty acids. So those derivatives, EPA and DHA, increase lipoprotein activity, lowering triglycerides biosynthesis and reduces hepatic lipogenesis. Has cardioprotective effects. It reduces platelet aggregation, decreases inflammation and blood pressure, reduces arrhythmias, and improves endothelial function. Then we've got the fibric acids, so fenofibrate. They activate PPAR to stimulate lipoprotein lipase, accelerating lipoprotein degradation. It has a GI side effects and it interacts with warfarin, so that's important to note. Cholesterol absorption, that's the ezetimibe. Inhibits dietary cholesterol absorption and GI side effects. And that is dyslipidemia, yo. Everyone get on a statin. Statins for everyone. Dyslipidemia. Okay, next video is stroke. See you then.